I'd like to call this meeting of the Cook County Public Health and Human Services Board to order at 8:30 a.m. on July 21st, 2026. First item is called to order. Did that. Second item, approval of consent agenda, and that includes our meeting agenda as well as the minutes, financial reports, abstracts, and bills. Are there any changes to the agenda or any items a commissioner would like to pull from the consent agenda? Frank.
Yes, thank you. I have a request. Unfortunately, I have a 9:30 doctor's appointment that I must make.
Okay.
And I do have something for the consent of the order. So if we could move that.
I'm sorry?
I have something to talk about for the consent of the order.
Consent
for
of
the, for the, whatever, for the
Good of the order.
For the good of the order.
Oh, sure.
So if we could move that part of the agenda, at least for me,
Sure.
up sooner.
Absolutely.
I would appreciate that.
Thank you. As far as I'm concerned. Any other changes to the agenda? Commissioner
Mr.
Sullivan?
Chair, I'd make a motion to approve the agenda as amended by
Thank you.
Frank.
Thank you, Commissioner Sullivan. We have a motion. Is there support?
Support that.
Commissioner Gamble, thank you. I have a motion and support. Any further discussion? Hearing or seeing none. All those in favor?
Aye.
Aye. Opposed? Motion passes unanimously. Thank you. 9:30, eh? Okay. Well, let's go on to our director's report. Grace, if you may.
All right. Good morning, everyone. Can everyone hear me okay? I'm always a little unsure with the microphone.
Just fine.
Okay, great. I will start with our staff report and our org chart. So we continue to have one vacancy that's posted, and we do have candidates that are working through the interview process for that position at this moment, and that's our adult mental health case manager role. So that is the big staff update at this point. I also just want to give a big thank you to the staff that we have covering the adult mental health case management caseload right now. All of our social services staff in adult services and behavioral health have really been stepping up to carry that caseload as we hire for that vacancy. So a huge thank you to all of them. We also have staff, because it is summer, out on vacation, so we have a lot of folks stepping in and helping, and I just want to thank our staff in PHHS for helping out and pitching in and covering all of the needs that we have that need to be covered as folks take vacation and are out for various reasons. So thank you to all of the staff in our department. We don't have a presentation from staff or community this month, but I do have a lengthy director's report. So I'll be talking more about the proposed reorganization that I introduced to you all last month. I'll be talking about merging our local mental health advisory council and our PHHS advisory council, as we have made some progress in that area over the past month. Emergency preparedness updates and other updates from the public health team, mobile crisis updates, and the public health fund updates. So it's a lengthy director's report. I just wanted to give you a preview of what's to come. And then I'm going to get into the reorganization discussion first. And Erica is going to be putting up on the screen, which should show on your screens as well, a visual of what the proposed reorganization for the department will look like. I'm hoping that it's large enough for folks to see.
Yeah.
We'll also include it with the minutes of the meeting, so if folks want to look at it that way, it'll be available and can be made larger as well.
When we do that, can we put draft on there?
There was a watermark that said draft, but I did switch it to PowerPoint in an effort to make it a little bit larger, and it seems like the watermark has disappeared. So I'll make sure that the version that goes out with the minutes does include that watermark, because this is indeed a draft at this point. So as I said in our last meeting, the goals of reorganizing PHHS are to, first and foremost, support a positive work environment within the department while continuing to meet our obligations to the state and the community. We're doing this by creating a structure that ensures oversight and accountability within our department, but that also supports our staff, encourages leadership development, and aids with retention. And while doing this, I do want to note that I have kept fiscal responsibility in mind, as I know coming into budgeting season, that is a key consideration for the board too, as they're making decisions. The process has been ongoing. So this isn't something that I just kind of came up with overnight. It's involved really studying the recommendations in the report from Megan Mose and her Birch Bark consulting firm, and that includes ongoing discussion with her as this model has been under development, discussions within our supervisor team and the other team meetings within our departments. It's also been brought up at our all-staff meeting for the last 2 months, and I've provided opportunities and continue to provide opportunities to discuss this draft with individual staff who may have questions, concerns, or suggestions for improvement. I've also been meeting with Administrator Treble Halbersma and HR Director Plummer, as well as with our HR consultants DDA. So this really has been a process that's included input from a variety of people and entities in an effort to try to create something that's going to work and be sustainable over the long term. I'm going to go into a few highlights here, and I'm going to stop after I talk and not just go through the whole director report, but as I get through the reorganization draft, give time for questions from our board as well. So some of the highlights: this proposed reorganization does not add positions to the department. Oops, my computer is going a little funny. Let's see. It removes 2 vacancies from the org chart in social services. These are positions that have been vacant for quite some time, and our current caseloads support this approach. It also holds a 3rd position as vacant in the 2027 budget, in other words, not budgeted. This position that would be held vacant would be within the Children Family Services team, and this is due to the potential for an increased workload due to the Minnesota African American Family Preservation Child Welfare Disproportionality Act. So this is, sometimes it's called the Act because it's kind of a mouthful, but it's new state level legislation that changes the way that we do child protection work across the state to involve what's called active efforts in an increased number of cases. And so this, in other counties, is resulting in increased staffing. Based on our population, I am not sure what the workload increase is going to look like for our team, so I would like to hold that position as available for the future as we assess what the workload changes will be in response to that legislation. This moves the total number of positions in the org chart from 35 to 33. Another key change is that it moves from us having 6 supervisors to 2 supervisors and 2 managers. So there's a manager position over social services. There's also a manager position over that I've titled the fiscal and administrative manager. And the reason for this is that it really recognizes that these 2 positions work quite a bit with developing internal policies, procedures, support with budget development. It also formalizes a backup for the director position in the event that I might be out. It provides a second in command that would be able to assume some of the duties that I typically assume is in the director role, just to have a clear and well delineated kind of plan for who would be second and third in command if there were to be an absence in the department. It also recognizes the leadership role that these positions play in representing our agency to external entities. The model also integrates lead workers across the agency. So a lead worker is not a supervisor, but it is a position that assumes some leadership duties within the team. That position would provide work direction, training, leadership, but not formally supervise individuals within a team. There's a potential for that lead worker role to be rolled into case aides as well. That's something that's still under discussion. And Another recommendation that we're taking into consideration is that's not represented in this image but is under discussion is integrating levels 1 and 2 to jobs for which there are multiple positions, such as case managers, eligibility specialists, and health educators. And that is a way to recognize candidates' skills, experience, and as people gain skills, experience, also provide an increase in their expectations and workload. So we'd be able to, for example, hire someone into a role at a level 1 or a level 2, depending on where they're at in their professional journey, and then kind of recognize them as they grow into positions within our agency. Two other pieces to note. The executive administrative assistant role would shift into a systems administrator role. That role would assist with information management and support for staff in accessing and learning the multiple software systems required in human services. Finally, the intake function for social services would become centralized in 2 positions that would spend time engaging in social service case aid work when they're not actively engaged in taking an intake. That would be a walk-in, a phone call, an email, somebody's kind of first point of contact with our agency. So that would, right now intake is a shared function across case managers in social services. Under this model, it would shift and be more centralized. There would still be backup for that function within the department. And it would also allow us to provide more paraprofessional support to our case management staff. So there's a lot that's gone into this. I do want to let you know that I was hoping to have job descriptions for vote for the social service lead workers and our social service manager. I'm still working on those with our HR director and our HR consultant, but I am hoping to bring those to you for vote at the general board meeting next Tuesday. And I want to just let you know that with these changes for the next several months, there will be job descriptions coming to you for review and for vote. It's not something that's going to go on forever, but it will be over the course of, I would guess, the next 6 to 9 months that these job descriptions are being updated, graded, and brought to you for consideration and vote. I wanted to give you this image, and I'll certainly provide updates as our thinking evolves. But the idea is to kind of roll these changes into this overall vision and give you updates along the way if this vision changes and this draft changes. I'll also note in the image itself, you'll notice that there are a few different colors. The dark blue represents positions that are that are either already filled or are new positions that are likely to be filled by current staff. The light blue positions are positions that we will likely be hiring externally. They're positions that are currently vacant in the org chart. And then that light green position is the position within Children Family Services that I'm proposing to hold for 2027 in the case that we need additional capacity in our Children Family Services team in response to the recent state legislation that changes child protection work. So a lot there. I want to stop, let it sink in for a moment, also give you all the opportunity to ask questions before I continue on with the director's report.
Administrator Treble.
Thank you. I would just like to add that I fully support these changes in this organizational structure. Grace has spent a lot of time and attention working with our consultant, Megan Mose, as well as staff, really listening to them and ensuring that this model meets the needs of the team and also most importantly, meets our community needs. So I just wanted to mention that I've worked very closely with Grace on this, and I fully support this.
Thank you. One thing I noticed, and maybe it's just a silly detail, but just want to bring it up to be clear, is just, so the lead is not a supervisory role, though on the tree it is imaged that way. And so
that is something that I struggled to change
Sure.
with the program that I use
Okay.
to visualize this.
Yeah.
I did hear that feedback. I just
Okay.
don't know how to make it look different. So it does look as though it could be a supervisory role on the org chart, but it is not.
Gotcha. Yep, just wanted to point that out. Thank you. Commissioner Gamble.
Thank you, Mr. Chair. Thank you, Grace. You touched on it a bit, but when you look at the organizational operations side of things and how it seems to make sense, how that translates through the lens of the job reclassification. And so we could, just from our understanding of classification, if you're going from 6 supervisors to 3 or whatever that number is, you would think that you're reducing and those job description responsibilities. So you mentioned it as we go through this regrading that we will be aware of that, but I think as you go through the process of reorganization, you can look at the operational side, how it seems to make sense, but understanding the financial side as to how that will translate is an important element of this. You can conclude that based upon the process we've gone through with the consultant and the discussion with staff, that the priority is getting the operational side as smooth as possible, based upon the input and what we know. But the financial side is a side that obviously we need to be mindful of as we move into this. So a scenario where you say that the grading was based upon a supervisory role, if we reduce the number of supervisors, will that mean that the grading reduces that pay grade for those that are no longer supervisors? And our policy would define whether or not somebody that has achieved a certain level would actually reduce that or not. That's just.
I would, so the grading process is through the HR consulting firm DDA. With this model, the folks that are either listed as supervisors or managers, I would assume that the managers' positions will likely be graded higher than a supervisor position. I'm not sure what that will be in its final form. I would also assume that someone assuming a lead worker role would be graded higher than the positions that are within that family. I think when Plowman presents on our proposed 2027 budget, we can get an idea of how the overall finances of this will look for 2027. But at this point, because we're still going through the process of creating the job descriptions and going through and having DDA go through the grading of specific positions, I don't have additional detail as to how these positions will be graded inside of the proposed reorg.
Well, I just wanted to also add, there are 2 vacant supervisor positions. And so we're removing those ones according to this org chart.
Mm-hmm.
So it's an elimination.
Which we've seen when we've discussed, in other departments where we're reorganizing, and because we're not going to necessarily move forward, with filling positions that we've had, that is something that you can correctly assume that there will be a compensation, adjustment based upon the fact that we're not filling some other positions, but still looking at this long-term, and I would say if I were Plowman, I would have a challenging time trying to project what it's going to be without knowing,
Grades.
where we're at on it, on the grade. And it's just saying, obviously, the operational side is an important thing, and we've learned on this journey the importance of trying to reorganize, and we have that opportunity to do that, which is excellent. But the component on the financial side is something that we have to be informed on. So,
Administrator Treble.
The other piece that I think is important to mention is that this plan does not mean that any positions would be demoted. So like Commissioner Mills shared, we'd be leveraging vacancies for different positions, but there aren't any current supervisors that then would shift to a lead position or otherwise within the chart. We're leveraging those vacancies.
Well, and leveraging the vacancies can be a matter of the dollars and where they're applied. And if we don't expend dollars over here, we can apply them here. But still, the grading system is a discipline based upon an evaluation of the responsibilities and roles of the position, which means that, and it's how it's looked in the grading to say that if you're going from a supervisor position to a manager position, you would assume there's going to be an increase in the grading. If you have a supervisor, if we have 6 supervisors and only 3 managers, if I've got those numbers right, that means that there's 3 that are no longer going to be in a supervisory role, if I'm understanding.
There's
what
2
you're saying.
managers, 2 supervisors?
Right.
So there's no supervisor that will change their title to be, there's 2 positions that would go from supervisor to manager, and there's 2 supervisor positions that would stay as supervisors.
Okay,
The additional supervisor positions that were within social services will shift, and instead there will be lead worker roles under the manager.
okay, that helps.
Mm-hmm.
Yeah.
That was
Thank
my
you.
understanding. Frank?
Yeah, Grace, if the lead positions don't have any supervisory responsibilities, you might consider, instead of having case manager 1, case manager 2, have a case manager 1, 2, and 3, and just call what you're calling the lead, it's fine, but just a matter of nomenclature, that would be your case manager 3, or your public health person 3, rather than calling them a lead, but they don't have any supervisory positions, authority. No, just
Noted, yeah.
Just
that's-
noted.
that's a
Well-
good point.
my other question, for my edification, what is the difference between a supervisor and a manager, other than the pay?
I think it is reflected in the development of policies, procedures, budgets, and also leadership with external organizations.
Okay, so that would be the manager has those responsibilities, the supervisor does not.
The supervisors, our primary role is supervising the staff within their teams.
Okay, thank you. And great job, by the way, putting all this together while managing everything else going on. It's kind of like overhauling your car engine when you're driving down the interstate.
I'm looking at this as long-term, but I don't want anyone to feel surprised. So I think this is probably the first time, but not the last time that you'll see this image and hear me talk about this. I mean, I did talk about it at the last board meeting, but the image wasn't accompanying it, and we weren't as close as we are today to bringing a few of these position descriptions for vote, so, yeah. All right, I'm going to move forward in the director's report unless there are any additional questions.
Okay.
Okay, so merging our advisory councils. So right now, we have a local mental health advisory council and a general public health and human services advisory council. We've been meeting together as one council for the past few months and been discussing what it would look like to merge these 2 councils. Part of this is because I think it would be more efficient operationally to have one group that meets regularly to provide recommendations to our department and to you all on the board. It also allows for both groups to hear what the other group is doing and hearing about. And so part of the conversation has been, how can we do this without losing the focus on mental health that was the impetus for creating the local mental health advisory council several years back. So this last meeting happened on Tuesday the 14th, and we really dove into the state statutes that guide both advisory councils. There are statutes to guide local mental health advisory councils. There are statutes to guide health and human services advisory councils. And so we started there by seeing what is it that is required of both of these groups, and is there a way to combine both into one? And there is. I think we just have to be very intentional about how to do it. So we looked at statute, we discussed a second draft version of mission and vision statements, and as well as a draft of bylaws for the merged council. We also talked about a template, kind of a draft template agenda that could guide our meetings, and then kind of an annual calendar of different topics, because there are different topics that need to be touched upon annually for each group. So we came up with a good draft, but we didn't have all of our members present. So what we decided to do at the end of the meeting was to circulate what we came up with for the mission, vision, bylaws among the membership via email, and to have an email vote and proceed with a simple majority of those responding by a set deadline. This has been somewhat delayed because of the events over the last week with air quality and wildfire response, but it's my intent to have all of that out to the membership before Thursday of this week, with the goal that after that vote, assuming that the vote is for merge, to start really intentionally recruiting new members, because we have members who've been part of the councils for a very long time and have been very dedicated. We have partner agencies who come on a regular basis as well, but I think we would benefit from really trying to bring new voices into those groups to provide a broader range of perspective. So we'll be recruiting from the general public as well as from the kind of more topic-specific groups that the public health team facilitates, groups like the Food Access Council, the Prevention Coalition, the Active Living Group, to see if there is interest in joining our advisory council. At our August meeting, we will be hearing the PHHS proposed budget from Plamen Dimitrov, our fiscal supervisor. That is in statute that our advisory council annually hears the budget draft and provides feedback on that. And so we'll be meeting again on August 11th for that, and then that PHHS 2027 budget will also be the topic for the August PHHS board meeting. So that's an update on that. Any questions on the councils before I continue on? Okay. Public health updates. So wildfire and air quality response. So the public health team has really been focused over the past week on responding to hazardous air quality and wildfire conditions across the county. So staff have been working with emergency management, the sheriff's office, the Minnesota Department of Health, and community agencies, most notably the YMCA. So the YMCA serves as a shelter site for Cook County, and we used it for an air quality relief shelter starting Tuesday evening through Sunday this past week. It also serves as an evacuation checkpoint. We did have 4 families come through who had opted to evacuate early during the set portion of Ready, Set, Go up the Gunflint Trail. The air quality relief shelter, this is the first time we had opened something like this. It was the first time we'd had multiple days in a row of hazardous air quality. So we had learned a lot. We had more than 40 community members come in looking for information or to just have a break from the air quality. We gave out over 300 masks to community members. We ran through our masks. We have more coming this afternoon, but we had a very positive response to people who wanted to take N95, KN95 masks. We also were able to order more child-sized masks. That's been a huge gap. Most of the masks that come through the state EOC are adult-sized, but children are more susceptible to poor air quality, so we do have more of those on order that should come today. We issued media releases talking about the air quality shelter. We also, Avi Sukwal, our public health supervisor, and myself were on WTIP last Wednesday talking about air quality. We also put out social media posts on how to follow air quality alerts, how to create a DIY air filter. And I think we met yesterday to debrief the operation and talk more about long-term planning. In the future, our plan is not to, open and staff the clean air shelter ourselves. What we're looking at is creating more of a community model where we provide technical assistance to organizations, agencies around the county that might have the ability to serve as a clean air zone, so that they know what that would entail. They have masks on hand, they have educational materials on hand, and then we'd be able to reach more people, and it would also ease the burden on staffing within our team. So we learned a lot doing it for ourselves, staffing it ourselves the first time, as to what kinds of questions people asked, what people were looking for, who used the space. And we're, like I said, moving into a longer-term planning phase, assuming that we will continue to have periods of hazardous air quality due to the wildfires throughout the rest of the fire season.
It sounds like an opportunity for bars and restaurants.
Yeah, it could be.
Try to get people in, safe space.
Yeah, absolutely.
Boost the economy,
Yeah, they need some help, so, you know.
Yeah.
social interaction, yeah.
So we are, this segues into some of the grant applications with the public health team. So we did apply for the Healthy Housing Grant. So Healthy Homes is a grant we've had for two 3-year periods in the past, and we applied for another 3-year period. This is a 3-year grant. It's $120,000 over the course of 3 years. A portion of this does go to offset staffing costs, and a portion of this also goes to mitigation work for households that have a housing assessment, or a housing-based health assessment by one of our staff in public health. This program's been very successful in the past, and I'm hopeful that we're able to receive funding to continue this work into the future. There's 2 additional applications that are in progress. One is the Boreal Waters Grant. That's to augment our youth prevention work. Another is a Rural Climate Partnership Grant. And this grant in particular, we're looking at how this could help us with air quality work. Because within our budget, we typically have primarily staffing costs, but these special projects, we don't have funding set aside for unless we're pursuing grant funds. So I'm hopeful that that type of grant could help us with things like providing materials to potential clean air shelters across the county, for example, which is project funding that we wouldn't otherwise have. We're also looking at a DHS grant to do risk reduction work, but that is in the assessment phase. So the only one that's been completed since the last board meeting was the Healthy Homes grant. Community health initiatives. We have outreach efforts in multiple areas with public health. Andrea Orest is gathering public feedback on the public health vending machine that board members will remember from last summer. We hit pause on the project, and the machine is currently in storage, but you'll be seeing media releases and articles coming out. We're trying to get community feedback on what a preferred location for the machine would be and what types of supplies would be helpful to include in the machine in the future. So more to come on that, but we are in a community engagement information gathering phase. There's also a number of events coming out that staff are going to be participating at to do outreach and education. That's Fisherman's Picnic, Grand Portage Kids Day, and future farmers markets events, where we'll be providing information on public health and human services topics. So lots of events coming up. Finally, I want to recognize Andrea Orest, who received a full scholarship from the local Public Health Association of Minnesota to attend the National Association of City and County Health Officials annual conference in Louisville, Kentucky last week. The conference is the largest convening of public health professionals in the nation. And Andrea and a handful of regional public health colleagues presented on the Speaking of Cannabis communications campaign. That was a regional effort here in the Arrowhead region. Moving into mobile crisis updates, I've been working with the Arrowhead Behavioral Health Initiative and First Call for Help to submit all the information that DHS needs for a contract amendment. A contract amendment is necessary for First Call for Help to be able to hire locally based mobile crisis response workers. First Call for Help, They were here in June, they came again in July, they're planning to be back in August, and as soon as they get the green light from DHS with this contract amendment, they'll be able to begin the hiring process. Our goal continues to be to have staff providing in-person response in October, and that is largely hinging on the date that the state processes our contract amendment. Finally, the public health funds. The public health fund is an annual grant-making project that runs through Public Health and Human Services. We did open the request for proposal period. Applications for 2027 funds are due by August 10th. At that point, the grant review team will begin to meet, review applications, and bring recommendations to this board at some point this fall. I'll also note that there is an information session for prospective applicants tomorrow. That's Wednesday, July 22nd at noon via Zoom. And the recording will be posted on our website afterwards. So past grantees received the link. The date was also publicized in a media release. This session's open to the public, and if folks are looking for more information or specifics on how to join, they can email phhs@cookcountymn.gov or reach out to the public health team at 218-387-3605. And that's the end of my director's report, so.
Thank you.
Thank you.
Yeah.
Any questions for Grace? All right. Thank you, Grace. That moves us right on down to our committee reports, so we're
But
on-
how about Frank?
Yeah, and we're on a record timeline here, so
Yeah.
take it away, Frank.
Okay, thank you. So I would like to address the public health emergency, which has been the air quality. Fires is important, but public health, it's all about the air quality. Living up at Gunflint Lake, my wife and I actually did evacuate to the city one night when the air was so bad that it was hazardous. So the rains have been great. They haven't stopped the fires, and they won't stop the fires, but they have done a bit to clean up the air. However, it's coming back. We don't know when, we don't know how long, but it's going to come back. There's been a lot of talking about the air filters, and thank you, Grace, for taking your proactive stance with the cooling and clean air facility at the Y. That was great. My own thought is that this is a teachable moment, as we call it, for air quality and what we can do about it. There's been a lot of discussion, as you say, as Commissioner Sullivan pointed out. Post office is full of air filters and fans. One thing that's been very clear is that there are not, and there will not be, immediately available air filters and fans locally. The home center even told me that they don't carry more than a MERV level 8, which is kind of medium air filter. So as a result, people, including me, went online and ordered online, and that's great, but it doesn't show up for another week, and meanwhile, you're breathing air. Okay, putting all this together, and putting this together with the cooling and clean air center, clean air facility. I had mentioned to Grace, and I believe she supports it, putting together a workshop in that area where people can build their own very simple low-tech air filters. Reminds me of Apollo 13. Do you remember when they had that oxygen problem and they put together some stuff with duct tape and air filters and very low-tech, but it works. So I've done the same thing. This is actually, and this is not going to cool a house, but it will give a fresh air for a person. This is just a little desktop with some chopped up KN95 mass on the back, and it works. It reduces the airflow a lot. You're not going to get the airflow that you usually get because you got all this in the back, but it does work and it's possible. What has been very in the news has been the Corley Rosenthal air filters, which is basically you take 4 air filters, you make a little square box, you put a fan on top, and you have yourself a perfectly usable, perfectly efficient air filter. I went one step further, and I said, well, that's true, But even that, simple as it is, with just duct tape and 4 filters and a fan, you can do the same thing with 1 air filter and a fan. Okay? This is a MERV 13, which is the highest level filter available, and would do a perfectly adequate job on your, on smoke. Okay.
Excuse me,
Problem
Frank,
is-
could you get that so that what you're showing is more on camera, or
Oh, it is.
It is.
you can see,
Okay.
it's hanging on the
All right,
edge
and again,
of
this
this
is
angle.
Yeah.
gaffer's tape, kind of like
Oh.
tape, gaffer's tape, and nothing, very low tech, but very usable. The problem is, in public health, you never want to give someone advice that they can't follow. If you can't buy the fan, and you can't buy the filters, telling them to make one of these is counterproductive. Because now they can't do anything about it, you lose credibility yourself. So, my proposal is, and I don't know exactly what the mechanism is, I would suggest that the board authorize or order or whatever, purchase of, as a pilot, 100 air filters. And that will cost about $1,600, less than that actually. 25 fans, at a cost of about $650, and a couple of rolls of tape. And have them available, so that the next teachable moment that comes up, the next time people are coming into the Y, we can have actually, whether it's a staff member or a volunteer, and I'll get to that in a minute, because I know of a lot of people who would like to volunteer and help, for your staffing, have a workshop available to show people, and it's just a little videotape, it's very simple, obviously. And the person staffing the cooling center could also be available to answer questions and even help out. The whole thing would cost less than $2,000. Have these available here, so you could just actually move ahead and get them. But don't wait until the smoke is here to order it. Time to order it is now. Preparedness. So that's my suggestion. I don't know exactly how you fund it and where the money comes from. I have no idea. But I'm just passing this on to the board for their consideration. Questions? Yeah,
Yeah. Did you buy the filter here in town?
I ordered it from Amazon.
Okay.
Couldn't get them in town. I did buy the MERV 8s, which is only half as effective. To make it clear, what that means is, if you wanted to filter a room, okay, first of all, you have to close the doors. You can't keep your windows open. Defeats the purpose. A MERV 8 filter might take 3 hours of running to clear most of the smoke out of the room. A MERV 13 would do it in half the time. So even a lower quality filter is better than nothing, but the higher quality filter is better. And they don't even stock these anywhere in town, the MERV 13s. And I ordered them online. I got 2 filters for like $25. And I'm sure if you're a county purchasing officer or whoever does this stuff, can get a better deal, buy them in bulk, buy them wholesale, whatever.
Administrator Treble.
Thank you, and thank you for that suggestion. We have an emergency management meeting, I think at noon today, if I'm not mistaken. Is that correct, Grace? So I would recommend that we bring this recommendation to that team, because we are working on what our plan is going to be as we move forward, to have a discussion about how that fits within the overall structure and plan, and then bring a recommendation back to the board next Tuesday at our board meeting about how we're going to support the community in the air quality sense as we move forward. But I also would like to hear from our public health director, as I know she's leading the effort around air quality, if that's okay, Chair.
Absolutely.
Sure, I mean, we've talked about, Frank has emailed, so we've been talking about the idea of doing some more proactive work with the community about preparing for poor air quality, and I think this would be a project that would fit within that. We still have some details to work out, but I think it's a great idea to provide people with ways to improve their indoor air quality, because as Frank says, if we're giving a recommendation that people can't follow, it doesn't really do much good. So yeah, I would support this.
Commissioner Gamble.
Yeah, thank you, Frank. A workshop requires people to be present. I'm wondering, as an alternative to that and creating accessibility, that if we were to do a YouTube video, that you could demonstrate, ideally, if you had the science behind it, you could say, here's an affordable air purifier.
Commissioner, there are many YouTube videos out there, some better than others,
Yeah.
and some with the science behind it, done by professionals.
Yeah.
Now, let me just clarify. I am not an engineer. I'm not
Yeah.
an air quality specialist.
Right.
However, I do have a lot of experience in this, because this is what I worked on back at CDC when we were worrying about H5N1.
Yeah.
And so I was very involved in that. And when COVID started, some of you may not know, or may know, I don't know, designed, specified, and had manufactured over 200, and imported over 200,000 masks, which were then distributed, about half sold, half given away, whatever. So I do have some background in this.
Sure.
But there are a lot of YouTube videos out there. We could certainly reference it. And one of
We
my
do have
suggestions-
one on our Facebook page last week from the EPA.
But you can't just, for some people, yeah, for some people, that's plenty. For some people, having a person there and having the materials there, that's it. You're not just telling them. You're saying, come here, you have the material, we have the fans, we have the filters, we have the duct tape. We have a staff member who's there anyway, who can answer any questions you may have. If you can afford it, this is the cost of the materials. $60, $75 a box, okay, for the four-sided one. This one's about $35.
Yeah.
If you can afford it, please reimburse us. If you can't afford it, fine, donation.
And as an option, I'm just thinking,
Yeah, oh,
you know,
as an addition, absolutely.
you can have a workshop if you want to
Yeah.
come in person, but, and it's good that there is a link, because there are very detailed, and we all know in watching YouTube, some people do it, you know, and they've got the science behind it. So you say, if you're in this type of situation, you could do this approach, which is going to give you the best, and it takes you X number of minutes, hours to clean a room of this size or whatever else. So a person can make that decision.
Yeah.
And, but resourcefulness is an important response to need, and I appreciate your making us aware of it, just how we can get that message out and to what extent we can, you know, provide the materials. But, yeah, some people are, as we know, when an emergency hits, it's an opportunity to make money in some
Yeah.
cases, and what we're trying to do is, you don't have to throw money at it necessarily. You can go to what extent you want, but here's a resourceful way of being able to address need.
Yeah.
So our response is genuine and not financially driven. Yeah.
Yeah. And again, just as an FYI, the MERV 13 level filter that I have here, there were two of them from Amazon, two of them for like $25. I prefer to shop locally when I can. When I can't, I do what I gotta do. I asked if they could be special. They don't stock them here in town. I asked if they could be. Yes. $45 each. So when I paid $25 for on Amazon, sure, they can order them. They'll be here several days. Two of them would cost you $90.
Yeah.
So-
Yeah, I would be inclined, just given previous experience in my life, to negotiate with a company in the circumstance, and it's good press for them, yeah, when they respond to see.
Yeah. But
Depending upon
the
how we
key
move
is going to be to have the materials, have the supplies here, ready to go when you need it, not order them and get it in a few days.
Yeah, bravo. And, yeah, well, my suggestion or thought was that we should partner with our local businesses
There you
to
go.
provide, to provide options. But economies of scale or supply chain, whatever issues might be, but I trust the emergency management team will look at it, and I think it's an excellent idea and a really excellent option. It's the
And-
way to go, basically.
And as far as bang for the buck goes, it's
Great. Can't be beat.
Well, the local partners could order on Amazon, jack them up $5, look really good. It's inexpensive marketing, but more importantly, they're here.
Yeah.
And I do know we have businesses that contribute without saying a word.
Oh,
A lot of money for a lot of, like, for housing, for all sorts, not just for school-related things. So,
They do cost, yeah.
yeah, they do cost, or they don't even charge costs. They just eat it. So,
Yeah. Oh, yeah, I believe me, I wasn't,
sure.
No, no.
I wasn't
no.
bad-mouthing our local businesses,
No.
no.
You're just
But-
the reality.
Yeah,
Yeah, if if you spend public money, that's different.
Sure. Yeah. Well, thank you.
Welcome.
And, yeah, I'll be very interested to hear back next Tuesday, just what we can do, or if any action needs to happen. I mean, perhaps there's enough leeway that the team can just do it or whatever, so, but yeah.
Oh, related to this, Grace, you mentioned staffing. There is a Signal chat group. I don't know if any of you use Signal. I do. My daughter told me that there's this chat group going about it's called Fire Mutual Aid Cook County. Completely unofficial, grassroots people, and there's about 50 members of it now. And actually, that's where I found out that you could buy these fans at the home center. So I did. I drove over there and bought the fan. And they had, first time I went, they didn't have any. Message came out that they have some now. I'm sure they're all gone now, but they have some. That would be an excellent source of grassroots information and volunteers to help staff your cooling center, your evacuation center, and so on. I realize that people are overwhelmed with information. I'm happy to be part of that. I can be a liaison for that if you like. If you want to put a message out, just let me know.
Thank you.
Yeah, one of the challenges, at least that I'm hearing in the fire briefings, is consistent and accurate information. And so I want to be careful that we're not creating more avenues of confusion.
No, but for a call for volunteers.
Yeah, absolutely.
Something like
absolutely,
that.
Yeah.
I know they put out a call for volunteers, as did many places, a call for snacks and stuff for the fire department, and we were overwhelmed. We got huge amounts in. I know that wasn't the only channel.
Yeah.
But I know that they sent somebody down to Costco for a Costco run and come back with a carload full of stuff. That's grassroots. So not to disseminate information. There's plenty of official information, sure. Go to your incident command public information officer. Go to the, sure, got that. But for other types of things, grassroots is sometimes a better way to go. Because you're getting people who wouldn't participate in the traditional government-sponsored channels. They're not going to go to the Public Health and Human Services Facebook page. So, just one more channel to reach people.
Yeah, thank you. Excellent. I know you have to leave, Frank. Is
I
there
do.
anything else that you would like to touch on in our community reports? We haven't had our community health board, so we don't have to, no.
Unfortunately, I can't report on the advisory council meeting, Public Health Advisory Council, because 10 minutes after the meeting started, I was called for fire department page
Fair enough.
for the fires. So, yeah, and Commissioner Gamble, you were there.
Okay. Well, thank you for
So-
your service.
so thank you.
Yeah, yeah.
Yeah, best to.
Well, then we'll bounce back here to the beginning of our committee reports, and we start with the Active Living Steering Committee. Commissioner White.
they haven't met.
No.
No.
Okay. And I was on the hook for the AEOA because you couldn't attend last meeting. Funny story. It was during our AMC District 1 conference day, and I was attempting to attend
Yeah.
virtually
Yes.
in the car, and was notified I'm not the alternate, so they wouldn't let me in.
You are the alternate.
AOA has it as Commissioner Storlie as the alternate, so I didn't argue, I didn't fight, I was just like, okay.
Are you the alternate?
But I figured they often have challenges with quorum, and so I figured they would want who they could get, but man.
They are pretty picky, so, yeah.
So that's my report for AO.
The nitty-gritty of
I've
life.
only gone once.
And I thought I was the alternate because I had been the previous, primary, so.
So,
A lot of
Well,
confusion
I asked
there.
you because you had
Right,
history,
exactly,
so
yep. Live and learn.
Frank, thank you so much for that.
Thank you.
Yeah, thank you, take care.
Oh, no.
Oh, no.
As you need.
That's great.
So my apologies for not having more there, but it was kind of a funny back and forth there for a little bit, because,
Well, what secrets were they telling that day? then?
I know. It's-
Well, you don't know.
No, I don't know, that's the
Handshake.
whole,
How about getting the minutes? Do you get the minutes?
I'm sure we can get the minutes, yeah.
And they're not usually forthcoming until the day before
oh,
the
Yeah,
next
because they're
meeting.
draft, and then they have to approve them, yeah.
Yeah, so,
Well, so that was something, but,
I'll remind myself too.
well, and you were busy as well.
Well,
You
so
were.
that
Oh,
wouldn't
yeah.
have worked anyways, so that's, because after they told me that, I thought, yeah,
Yeah.
anyways.
I can say one thing about the AEOA, and I don't know the official name for it, but annually they have a big, huge community celebration. And they, for all of, and
It's in the Civic Center or something? Or
it's,
is it-
well, no, it's in the range where they have, and they do so much more, like putting up housing, like putting homeless people in shelters, like to have a real place to live.
Yeah.
So they do much more in that part of the state, and they have an annual barbecue, and they get people to come together, and I did ask or sent that along to if there was anyone on the Council on Aging, and they sent it to the bus drivers, the AEO bus drivers, if they would be interested in attending, because that would, I don't know if anyone went, but,
Fun.
yeah.
I went to that once, and it was very impressive. We had a AOA meeting just after it in the event center that it was being held
Oh.
at, but holy cow, it was like.
Well attended.
Yeah, imagine the community center curling rink area ×4 filled with people.
Oh.
It was just like, whoa, okay. It's a whole nother level over there with population, so. Okay, well, that brings us to the Arrowhead Health Alliance. Anything to report there?
No.
Okay. Arrowhead Regional Corrections, Commissioner Gamble?
Yeah, thank you, Mr. Chair. So, at our last meeting, which was the 17th of this month, the Arrowhead Regional Corrections Facility is the third largest corrections institution within the state, but it ranks first as far as the largest service area, serving the 5 counties that are participants. And the budget was presented, and during the 2018 budget process, the Board of Directors made a decision to make an annual contribution to the Capital Improvement Operations Fund balance in the amount of $400,000. So that commitment was made in 2018. And as we're looking at the 2027 budget, they brought before us 2 options that were presented, and we could either continue to comply with the policy to contribute $400,000 to the Capital Improvement Operations Fund balance, or in an effort to reduce the 2027 budget's impact on partnering counties, option 2 would reduce the contribution to $300,000. As part of that discussion is, as we are aware, and we often do this when we look at non-mandated organizations, when they're asking for taxpayer dollars, if they have a significant fund balance, why are they not dipping into their fund balance? So part of this proposal to reduce the contribution from $400,000 to $300,000 was predicated on the fact that the fund balance has built up, and when they go to legislatures and ask for money, that the legislatures typically will look at, well, you've got this fund balance, why are you asking for the money? So it's twofold. Another proposed change in the 2027 budget that would benefit both Lake and Cook County involves the office specialist position in support of the probation officers. Currently, Lake County has one clerical full-time employee assigned, and Cook County has one clerical full-time employee assigned. The Cook County office specialist recently submitted her resignation, and ARC has taken the opportunity to re-examine clerical workloads and the prospect for budget reduction in the two counties. It is believed that one shared Cook and Lake County full-time employee can complete all clerical work in both counties. Prior to the most recent clerical hiring in Cook, ARC ran without a dedicated Cook clerical staff for many months and multiple times, as it's been difficult to fill the position in Grand Marais. So ARC has no issues with having the Lake County clerical specialists cover work in Cook County during those months. So there are only 5 probation officers between the two counties, which is a manageable workload for one clerical staff. So ARC believes that having one clerical doing the work for the two counties is viable and fiscally responsible. Therefore, ARC intends to reduce both Lake and Cook's clerical complement from one full-time employee to 1/2 for each county. In simpler terms, you would share the cost for one full-time staff. This would reduce Lake and Cook County's annual contribution to ARC by approximately $40,000 each, a reduction of 17.66% over what we contributed in 2026. So Becky, the director, did email the two sitting commissioners on that board to ask their opinion, and I felt that given their experience, having the individual covering in the position with Lake County, that it was well reasoned, and certainly if the board has any response to that, we can express that. But
I have a question. That includes Grand Portage, their probation officer, or no? They have one that is Storlie, who's approaching probation, very hands-on and involved. He is personally involved in the lives, more than just meeting.
Right.
However,
so the probation officers are not changing.
Right, it's clear.
It's the clerical support.
but does Cook
And
County
I
report?
I can't answer that question as to
just
whether the
curious.
clerical report, I think that Becky would have indicated, how that would affect Grand Portage, but I can certainly get clarification on
I
that.
don't know the financial anything with that, but I do
Yeah.
know this.
Yeah, the probation officers are there, and I don't know that Grand Portage has had clerical support in the past, or if our position supported Grand Portage in that regard. But
Administrator Treble, you had your hand.
Yeah, I don't know the answer to that either. My assumption would be that he would receive support just like any other probation officer within ARDC, but I'm not certain on that. We would have to ask. But my question would be, is that position going to be fully, will they office full-time in Lake County, or will they split their time between Cook and Lake? And the only reason I ask that is it has impact on our future building study.
Sure. My understanding is that because when we have been without that position filled, that it's been filled by the individual in Lake. And so that individual would remain in Lake County, but service Cook County from the Lake County position.
Okay.
But I can get clarification on that as well. But I'm assuming that the experience has informed the recommendation, and it would continue that way. Or if they were saying that they would split their time between the two counties, that they would indicate that. But I'll follow up on that.
Has there been feedback from probation officers on this?
I can't answer that question, although what Becky, administrator for ARC, it said is that the experience has been such that it's it's fulfilled the need when we have been without, that the clerical support from Blake has been able to handle it, because we only have 5 probation officers.
Yeah.
But I can ask that question as well.
Yeah, and the reason I'm asking is because we've had a hard time recruiting and retaining probation officers. So if they have less support, it'll only make it harder to
Yeah.
recruit and retain, and so that's a
Yeah, and
concern.
that's, respectfully, that's an assumption that the problem is they aren't getting the support.
No, I'm just
Yeah,
saying.
you know what I'm saying.
Well, I flipped it around. I'm not saying that is the reason we've had a hard time, but I know with less support, it would be harder. Like, for example, if an administrator had, no, if the EDA, say, had a director who was doing all of the clerical duties as well, it's a lot harder to get the more pressing, higher level things done. And so that support not being there, that's why I'm concerned about the probation officers.
Yeah, well, but in this scenario, I mean.
There's enough support.
This scenario, given there's only 5 probation officers,
Right.
our experience has told us that you can have a part-time position in each county.
Yep.
And so, but they can ask the question, have the probation officers in the 2 counties weighed in on this? And so I can
And maybe
ask
that's
them.
not appropriate, maybe it's their supervisor, right? Maybe that's, but that's where my thoughts went.
Yeah.
Well, and we had a probation officer. It's not like they come and go like administrators. We've had, sorry, you had to throw that in there. No, we had one, I don't know, he was here 10 or 15 years, because I had one of my students then had to leave school and was under, and then he was someplace else, and I just more than once offered, like, this was a child who didn't know good touch, but for some reason he bonded to me, with me, and so, but that was many years ago, but he was here a very long time.
In the presentation at the last meeting at NERC, Phil, who's in charge of court and field, made a presentation. And the number of senior staff in his department, you're talking 28, 35, 26, 38.
They're all going.
Amazing, the longevity. What it says is that people stay with an organization that they feel good and welcome working there. And I commented on it because when he showed that, the key staff, it was like, wow, that's amazing. And so when he was going through on down to probation officers and each of the 5 counties and regions within the counties, I looked at the longevity in those positions, and there were 2 counties where there is considerable turnover. And oftentimes you'll hear when Phil gives the court and field report that we finally got a probation officer in Grand Marais. And so I asked him, do you know why it is that it's difficult recruiting in Grand Marais? Is it, and to get a context to understand that. And for some people, it's the cost related to the pay, the cost to live there, or can't find housing that's affordable based upon their wage. Or it's, I didn't know it was so remote, and I'm used to big city living, you know what I'm saying? But understanding that says to us, what do we need to do in order to make it attractive, so.
Or is there anything we can do?
Well,
Remote is remote.
yeah, and it depends. But I'll follow up on the 3 questions.
Yeah, and the housing was my understanding, just, and
Sure.
you guys are gonna have way better perspective than me, just being at Arrowhead Regional Corrections. I haven't sat on that, but just worked with probation supervisors on different groups, so. The other concern I had was about the 300,000 capital improvement. Again, you're gonna have way better perspective on this as far as what the capital improvement needs are, but I know costs have only gone up. And so to reduce how much you're putting towards things seems like you're shooting yourself in the foot for,
Well, you have to have context. to
Exactly.
understand
Right.
that. Yeah, and that's the point. I mean, if you don't have context, then the question is aptly,
Right.
questioned.
yeah.
But when Becky, who's in the position, as I have mentioned before, has been in each department, each segment of NERC overall, and I sit on the Human Resource Committee that evaluates her. And it's just amazing the feedback that comes back from staff. And that's because she has perspective and context.
Yeah.
So I say that simply to say that in looking at the financial and with the financial committee, that this recommendation is based upon a context that understands the importance of being good fiscal stewards. But there are 3 or 4 quotes that came out of the meeting that I would repeat in our budget process, and I debated whether to repeat them today relative to fiscal responsibility. And because we did not have a quorum, we could not make any decisions, and we could not approve the proposed budget. And so the chair said, well, then we would just, go to the next meeting, which gives us no time to really deliberate or make any changes. And I said, well, because we have a fiduciary responsibility as board members, we need to be sure that we're protecting the integrity of process here. So we looked at either holding a special meeting, which was very difficult at this point prior to our August meeting, or to present a budget that had narrative. And so all that simply to say that understanding context and working very difficultly to be diligent and good stewards of what's entrusted, I have confidence in the financial committee and their recommendations that came before us. And but I understand the question without the context. Yeah.
Yeah, and part of my concern too, and again, I have no context, so I'm just talking here.
Yeah.
But part of my concern too is some perspectives on fiscal responsibility are thinking right now. But I think it's really important to look at the whole, like, capital improvement project, say, like, if we're cutting now, what does that mean for capital in the future? And so I have no context, but those are just my thoughts. Like, is it fiscally responsible to give us less pain now, but more pain, financial pain later? Or is it more responsible to give us a little more financial pain now and less later, and so, again, no context, that's just my
Well, if you put it in your personal context, as a family, you certainly understand, or you should be aware of where you're at as a family, and what you're going to do for improvements on your house, or what you're going to do for your vacation, and what you're going to do and how many times you go out to eat. That's based upon where you're at. You might have an expected bonus that you've gotten annually that the company says you're not going to get. That means there's a ripple effect as to your response to that. And so in this context, where there's organizations, we sit on boards where we feel that the integrity and process has great oversight, and that their experience has demonstrated that their decisions are wise, and I have that confidence. And the other thing about it is that if we move forward in the context of just tax and spend without
No, this is planning, capital planning, that's what I'm talking about. I'm not talking about,
Yeah, but you have board members that come from the 5 counties that are saying, we can't have a 21% levy this year.
Sure,
We
yeah.
can't. And so
That's 'cause they didn't plan
they're
before.
hearing that, and they're really looking at it. My response when Becky had sent me this email about going to the halftime, I said, I really appreciate the due diligence, the willing to look at everything and to see what we can do in response to the concerns that are expressed by the commissioners there. So anyway, But I'll get back with an update on the 3 questions, which has to do with support for Grand Portage, were probation officers involved, and how comfortable are we with the decision to reduce the capital contribution?
Yeah, and not how comfortable, but what are the impacts of reducing the capital contribution is what I would be wondering.
Yeah.
Administrator Treble, sorry.
Thank you, Chair Mills. In conversations that I've had with Becky, the administrator or the director, she is willing to come to a board meeting at any time as well. So if we do want more information and specifics about this or any updates to the board, we could certainly invite her.
Thank you. And we have met her, she has been here, but again, I don't have any context, and I trust Commissioner Gamble and Commissioner White and the ARC board to have this context and to make these decisions, but those are just concerns that came to the front of my mind. So.
Yeah.
And, I'm sorry.
Good.
Go ahead, Commissioner.
And if Becky were to make the journey here at some point, she would be the person that could explain to the public, what is NERC? Like, NERC is a lockup. Well, it's a little more than that, and it's, when you talk about capital improvements, it's not a new kitchen or bathroom facilities. They have buildings and they have programs. They have a farm.
Buildings, yeah.
So they have expenses, and I think it's valuable for the public to learn more about that place.
The other way to look at it is to say that if in 2018, we made a commitment of $400,000 contribution, that what has happened in 2018 that informed that decision, and at 2026, how have things changed that just because we made that decision, do we continue to operate that way? So
Well said.
I appreciate, my comment would just say the diligence that is demonstrated in looking at everything. Yeah.
Well said. That's thank you. That's very well said.
There you
And we know there have been significant changes in the demands of our probation system, our jail system, everything. You know,
Yeah.
it's
And-
very different landscapes.
And I would say that, and I've said this before as Commissioner White, but NERC is an amazing facility, and there isn't a board meeting that goes by that there aren't letters from parents or from individuals who have participated in the program. And legislatures recognize, too, that NERC is unique in that it addresses human need, and it is not a punitive approach to changing people's lives. So we are very fortunate to, as a county, to have that relationship.
I agree. Thank you. All right, anything else? There, okay. Community Health Board, we have not met. Last time I told you about hantavirus and some of those other, and Ebola, some of those other scaries that the doctor's report had, and I'll have a report next month. It's only every other month for the Community Health Board. The Cook County Local Advisory Council for Mental Health. Ranna's not here today. I think Grace gave some highlights there. I don't know if there's anything else we want to add, Commissioner White?
No,
Okay.
it's just to the combining of the two boards. I think it's far more, there's more information. It's worth my time more on a personal level. I get a lot more out of it, and there's better conversations, communications. I feel it's really a good thing.
That's great feedback.
Yeah, I just really like it.
Thank you. Anything from the Council on Aging, Commissioner White?
No,
Okay.
I mean, they're just moving forward,
Yeah.
head down.
Emergency Preparedness, Commissioner Sullivan.
Well, if you'll recall, last month, both Grace and I talked a little bit about the meeting where we reviewed the Highway 61 or Stewart River fire in Lake County, and thinking back to that, that was very timely, given what we're experiencing here. Had an opportunity to think about lessons learned from Lake County, and all the education and outreach that both public health is doing, that commissioners are doing at different meetings is really helpful. We've had, as you know, 2 public meetings up the Gunflint Trail to discuss the fire, and yesterday with having the NEMO team in there, one of the things that was really excellent is they talked about the weather intelligence that they use to look at fire behavior, all the modeling, all the science behind it, that they can really only go out about 7 days. But they made a point of talking about the fact that we are entering into the last half of July and August, which is going to be hot and can be extremely challenging. And they reminded the public that fighting these fires are very different. It's not only because of the extreme terrain in that area, but these are, many of them, fires that are in the duff, so 2 to 3 feet below the level of the surface. And it's old twigs and pine needles and debris that's rotting, but also burning. And talked a little bit about the resources that are coming into our community. We've had people arrive from Colorado who had been fighting fires out there, people from Arizona. We have the big Chinook, which is the heavy lift helicopter, which is used for fighting fires, and also they have a really wide ramp at the back. It's got 2 helicopter blades on the front, a tail rotor, and this big ramp where they can load all kinds of people and equipment in it. So the airport is incredibly busy right now, and we are sharing resources and switching them around on a daily basis from Ely to Hibbing, Duluth as well, and even Orr. Yesterday we ordered a porta potty because we want to make sure our septic system is, it's designed at a small usage, and so we're getting those resources into the airport. And then just a reminder that although we are all really consumed with our wildfire, that there are extreme wildfires all over the United States, we're sharing a lot less resources than we had, a year ago. The firefighting numbers have been reduced from 30,000 to 20,000, and so we're sharing those nationwide. We can't call on our Canadian partners because they're overwhelmed. They're at the highest level of national preparedness as well. So we actually have crews from New Zealand and Australia that may be joining us. So I would just encourage people to continue to follow those meetings. They are recorded. They've got them on the WTIP website as well as the Forest Service website. And I would encourage our community in the West End to attend at Lutsen tonight, or at a minimum be there online to participate in those meetings. We're going through masks like crazy. I went through all of the masks that were left in emergency management. Grace has mentioned we have more coming today. But with that air quality the way it is, they're flying off the shelves. So dig out any you have in your home, because we are going to need them again.
I'll add that you can reuse them. You don't need to use a new one every single day. You can use them until they're visibly soiled. So you can use them multiple times before picking a new one up.
Absolutely. And the other thing that we're going through are all the handouts on air quality, wildfire mitigation. So Grace and Emergency Management are making more copies so that Commissioner Storlie has them for tonight in Lutsen.
Commissioner White.
Would you please tell the public what NEMO is?
Oh, it's
And who's in charge of all this fire stuff at this moment?
It's the National Incident Management Organization, and that means it's a really high-level fire to be able to get those people to come to our community. It kind of would make us think that this is a bigger deal than some of the other fires that we've had in the past. And they're doing an outstanding job. They've set up at the community center. There are a lot of different U.S. Forest Service and incident vehicles that are up at the community center, and then also here in our boardroom we have kind of our local group that is working, so.
And they will be here in a half an hour.
Yep.
Nope.
To provide us an update to the board on the work that they're doing, why they're here.
Yep.
We don't have a plan of action yet from them of how they're going to address the fires. They're still working on that with their fire behavioralist and with the meteorologist and others on their team, but they'll share the information that they do have at this point with us.
Yeah. And yesterday, one thing they focused on was that their firefighting on the west end of the boundary waters is to, right now, be protecting property, their businesses, cabins, resorts, things of that nature. Here, we are burning in an area where there is none of that yet, all right? And so, and the fire, the Little Knife Fire at the end of the Gunflint Trail is 0% contained because they aren't physically doing anything at this point. They've just been able to get aircraft in the air, the helicopter yesterday, and get a good view of the fire from the air, so.
Administrator Trumbull.
Okay, thank you, Chair. One more item. I wanted to make sure, since we're talking about this, that the community is aware that the PIOs, the Public Information Officers from the Forest Service, are doing a daily check-in with Callie at WTIP sometime between 10 a.m. and 11 a.m. on North Shore morning. So they're providing a daily update to the community via WTIP.
I bet you they record and play that at their North Shore News Hour. but-
I'm assuming, but I have not been able to confirm that yet.
All right. Thank you, Commissioner Sullivan. Thank you, Administrator Trumbull. Commissioner Campbell, you had something?
I was just going to say that if communication had the ability to put fires out, this fire would be out.
Agreed. Let's see, anything from NACO, Commissioner Storlie?
We will meet next month.
Okay, thank you. Northeast Minnesota Office of Job Training, Commissioner Gamble, nothing, okay. No priorities. North Shore Collaborative has not met. Advisory Council, we've touched on already. And Food Access Council. What can I share? I think I already shared the Food as Medicine program, and that has now started, it has begun. This isn't directly related to the Food Access Council, but the Northwest Food Project and Community Center have their farmers market, and that is normally in the Community Center parking lot. That's moved to St. John's Catholic Church parking lot, so spread that word. I guess that's all I have to share about the Food Access
I
Council.
believe
And the farmer's market has moved to ISD 166.
I
Oh,
think
wait,
the
wait.
farmer's market is moving to the Catholic Church parking lot,
Oh,
but
it
then the
is.
Second Harvest mobile
Second
food
Harvest,
pantry
thank
is
you.
moving to ISD 166.
Oh, okay, thank you.
So both of those had taken place in front of the community center,
Yeah.
but because of the emergency operations center that's opening there, they're both moving to different locations. So I know we're trying to
Thank
share
you.
those messages out on social media as well.
Administrator Treble, you had some?
I have just one more item to add, but not on that.
Oh, okay. And then we touched on good of the order, Frank did. Anything else anyone wants to share there? Okay.
Thank you. The one item I wanted to share is that we are struggling with the pool at the YMCA, and I know a lot of community members are concerned about that, so I just wanted to touch on that. Given the air quality, we had to shut down that facility temporarily because it was pulling external air into the facility. And so Brooke was sending me, our facilities director, is sending me messages right now that he is actively on the roof at the Y. We are trying to fix that. We are trying to also take some steps to make sure that the air quality is where it needs to be in the facility. But since we are in this meeting, I wanted to make sure I shared that with the community.
Is it safe to text on roofs?
That's a
Is he tied in? Does OSHA know?
good
Sure
question.
he's tied in.
Would you explain why? Is it the whole YMCA? I mean, why does he have to suck in air from the
It's-
pool area and send it out? There's
Sure, so it's just in the pool area where we're pulling in external air. We were able to shut it down so that we're just recycling internal air within the rest of the facility. but we wanted to shut that down so that it doesn't impact the rest of the facility. And when we did, it created some other issues that we're now addressing.
And the reason for the pool air stuff is to ventilate
The chlorine.
chlorine air, and,
Yeah.
yeah, it's a whole
Moisture
thing.
and-
Yeah,
Correct,
Correct.
yes.
it's a whole thing.
So more than anything, I just wanted the community to know that we're working on it, and we'll do our best to try to get that up and running as soon as we can.
Thank you. Thank you, Brooke. Okay, well, with nothing else, we are adjourned.
And then we did post the special meeting as 10 a.m., so we'll do the special meeting really quick, and then we'll take a break before we have committee of the whole.
Yep.
And the special meeting, I'm not sure if anyone's even seen that yet.
Yes.
But, okay.
Just real quickly, did you know that Schmitz, Andy
you.
and
Oh, thank you.
Amy, that they bought
All right.
that west